China said today that it's, quote, extremely unlikely that COVID-19 came from one of its laboratories 2 days after the CIA said the virus may have begun to spread after an accidental leak from a research facility. Now, the agency's finding is not the result of any new intelligence. The report was done during the Biden administration and then declassified and released Saturday on the orders of new CIA Director John Ratcliffe. The CIA does, however, acknowledge it has, quote, low confidence in its own conclusion. Dr. Céline Gounder is here with me now in Studio 57. She's a CBS News medical contributor and editor-at-large for public health at KFF Health News. So why has the CIA shifted its stance toward this? And remind us what the other possibilities were. I mean, I remember, this was only a few years ago, the wet market in Wuhan, why that maybe isn't the prevailing theory anymore for the CIA?
John Ratcliffe, who's the new head of the CIA, has long thought that COVID was the result of a lab leak. Again, this is not the result of any new intelligence per se, but really how people synthesize, analyze, and weigh the existing evidence. But I think it's also important to emphasize that the confidence that the CIA has in this assessment is low confidence. And so I think big picture, we still really don't know, and we may never really know where COVID emerged from.
What is the lab leak theory? Again, just catch us up to speed.
The idea being that there may have been an accident in a lab where scientists were working on COVID or COVID-like viruses, perhaps mutated at some point to become COVID. And in fact, there are different theories about even which lab. You have the Department of Energy that thinks it was from the Wuhan Center for Disease Control. You have the FBI, which has said with moderate confidence that they think it comes from the Wuhan Institute of Virology. The CIA has not said which lab they think it came from, but they think it might have come from a lab. So there's a lot of still, even within the intelligence community, conflicting opinions about where this came from.
And Wuhan being where the first cases were discovered.
Exactly.
Okay.
Exactly.
So what does it tell you that these agencies don't even agree?
Well, you know, there's also disagreement, right, with the medical and public health and scientific community. I think some of this is a result of we focus on different kinds of information. So intelligence agents are going to focus on what are emails and telephone calls that they can intercept, satellite imagery, those kinds of information. Whereas we as scientists will look at the genomics of the virus, how it's mutating, at what pace over time. Can you find a bat that has a close ancestor of COVID? Can you find direct evidence in the lab that they were tinkering with the genetics of similar viruses? So we just weigh these things slightly differently and have a different perspective as a result.
But does it make you worry that if we may never know, how are we going to prevent the next one? I mean, yes, it is important to be prepared. We know that we need more PPE stocked up just in case something happens. But the ultimate goal for finding the origin is to make sure we never have to live in times where refrigerated morgues are parked on the street.
Well, I think it depends. I think for some people, it's important to know how it emerged because they want retribution. They want to maybe revenge. And, you know, I think it depends on your perspective. Accountability. I think for the scientific community, public health community, we just want to prevent the next big one. We're not really focused on the past. We're more about, okay, how do we prevent this in the future? And I did have a conversation recently with Admiral Brett Giroir around this. So as many may remember, Giroir was the COVID testing czar under Trump in 2020. And we talked a bit about how do you prevent something like this from happening again?
Is wastewater that kind of early warning system that might alert us that there has been a lab leak from one of these BSL-4 labs?
Yeah, absolutely. Wastewater monitoring is an outstanding way to monitor any geography at a given time for the organisms of your choice. And so it certainly could be used as an early warning system for a lab leak or a natural epidemic.
So we want to be preventing, whether it's a lab leak or it's a wet market in Wuhan, we want to be preventing these things from happening again. And what we talked about was, could you use wastewater testing, for example, right outside one of these high-tech BSL-4 labs that work with dangerous pathogens? If you have a lab leak, you would see it in the wastewater. If you have a lab leak outside of a wet market, you would see it in the wastewater. So can we be more targeted in that way?
Interesting. Where else can people watch the full interview?
It'll be airing soon. Okay. We'll just stay tuned.
Watch CBS all the time. Dr.
Exactly.
Céline Gounder, thank you.